Coping with Trauma-Related Dissociation, Skills Training for Patients and Therapists by Suzette Boone, Kathy Steele, and Onno van der Hart is a highly practical, structured, and compassionate guide designed for individuals who live with trauma-related dissociation and the therapists who support them. Unlike theoretical texts, this book is a hands-on training manual meant to be used directly in therapeutic settings. It presents dissociation not merely as a symptom but as an experience rooted in survival, and it equips readers with the skills to build a life that is safer, more stable, and increasingly integrated. The book opens with a gentle orientation to what dissociation is and what it is not. The authors are careful to demystify it, emphasizing that dissociation is not madness or weakness, but a natural coping mechanism that develops in response to overwhelming experiences, especially chronic childhood trauma. The tone is reassuring, addressing both patients and therapists with respect and honesty. From the start, the reader is invited into a collaborative, empowering process of recovery that avoids pathologizing. One of the most powerful aspects of the book is its structure. It is divided into clear modules, each focused on specific skills such as grounding, emotion regulation, boundary setting, managing triggers, and improving internal communication between dissociative parts. Each module builds logically upon the last, creating a sense of steady progress rather than overwhelming the reader with too much too fast. The authors emphasize pacing, something often missed in trauma recovery. Going too quickly can destabilize a client with dissociative symptoms, and the book is designed to respect the fragility of trauma survivors while still nudging them forward. Each section includes explanations, sample dialogues, patient worksheets, and exercises. The material is practical without being simplistic. Skills are explained in a way that encourages experimentation and flexibility, recognizing that no single strategy works for everyone. For example, grounding techniques are offered in multiple formats: mental, sensory, and physical, so readers can find the ones that work best for their unique system. Therapists are encouraged to tailor the exercises to individual needs, which reinforces the book's commitment to empowerment over rigid rules. The authors introduce the idea of parts gently, using non-stigmatizing language. Rather than presenting dissociative identities as dramatic or extreme, the book treats them as natural, often subtle internal divisions formed to survive trauma. These parts might be emotional, protective, managerial, or childlike, and the goal is not to get rid of them, but to build cooperation and understanding. Exercises in internal communication help patients begin dialogues with their parts, validate their roles, and reduce internal conflict. This respectful approach is critical in establishing internal safety and self-compassion. Throughout the book, there's a focus on helping patients distinguish between the past and the present. This is essential for trauma survivors, many of whom live with a persistent sense of threat. Flashbacks, intrusive memories, and emotional flooding are reframed as misfires in the nervous system. Survivors are not broken, but their brains are responding to danger that is no longer there. The skills provided aim to create enough internal and external safety so that the past can stay in the past. One of the strengths of the manual is how it teaches both patients and therapists to recognize and respond to triggers. The authors normalize triggering as part of the healing process, not a failure. They show how to identify cues, slow down reactions, and recover more quickly from being overwhelmed. The ability to observe one's internal state, pause, and choose a response is a major theme across the exercises. This supports the development of what the authors call the observing self, a stable perspective that can anchor awareness and allow for more intentional living. A particularly helpful module deals with managing shame and self-hatred, which are pervasive in survivors of chronic trauma. The book tackles these experiences not as character flaws, but as internalized survival strategies or parts of the personality trying to protect against vulnerability. Exercises help survivors understand where their shame originated and how to respond with curiosity and kindness instead of judgment or avoidance. The therapist's voice in the book is one of calm, patient presence. There are frequent notes to therapists about how to pace sessions, how to spot signs of overwhelm, and how to validate clients while holding space for discomfort. This guidance prevents re-traumatization and models the very safety and attunement the book encourages survivors to seek. It's a clinical guide that never forgets it is working with human beings, not symptoms. In addition to internal skills, the book includes guidance for improving external functioning, setting boundaries, managing daily stressors, and navigating relationships. These are all areas where dissociation can interfere, especially when survivors have parts that hold conflicting needs or beliefs. Through role-playing, journaling, and guided imagery, clients are taught how to advocate for themselves, ask for help, and create lives that feel more coherent and stable. The tone remains steady and optimistic even as it acknowledges the difficulty of the journey. It is realistic. The authors do not promise quick fixes or total integration, but rather a gradual increase in choice, connection, and compassion. They stress that healing from dissociation is not a linear or finite process, but one of learning to live more fully in the present, with greater flexibility and awareness. What sets this book apart from many trauma texts is its dual address. It speaks both to the person living with dissociation and to the therapist supporting them. This dual perspective enhances its usefulness, whether it's being used in a session, as homework between sessions, or independently by survivors looking for support. It becomes a shared language between client and clinician, a way of building a bridge over the often chaotic inner landscape of trauma. By the end of the book, readers have not just learned about dissociation, they've practiced living differently with it. The repeated encouragement to stay connected to the present, to the body, to others, and to the self forms the emotional core of the book. It doesn't rush survivors to resolve or explain their trauma. Instead, it helps them build the strength and clarity to live alongside it, and eventually, beyond it. Ultimately, coping with trauma-related dissociation is more than a manual, it's a companion. It respects the intelligence, resilience, and complexity of trauma survivors while providing them with concrete, repeatable skills to reduce suffering and build internal trust. In a landscape where many survivors feel fragmented, isolated, and pathologized, this book is a steady, skillful hand extended across the chasm, offering tools, patience, and above all, hope.